Thank you. Thank you all for joining us today. For this media event, initially, each attendee will be muted. If you wish to ask a question after the presentation, please raise your hand. If you are joining us by computer today, the raise hand button is located at the bottom of the participants list. If you're calling in, please press *9. When it's your turn, we will unmute you and ask you to proceed. You may also type your questions into the chat box. You do have our permission to record today if you are able to do so, and we will have a copy of the recording available upon request. Today, our panel includes Commissioner Marilyn Kirkpatrick, Chief John Steinbeck, Scott Black from North Las Vegas, who's also the distinguished president of our Board of Health. We have Ms. Joanne Rupiper and Dr. Fermín Leguen, who's our acting Chief Health Officer. So we will begin today with Dr. Leguen.
Okay, thank you, Corinne. Good afternoon. We wanted to provide an update on our immunization campaign, and so we want to make sure that our community is aware of what's happening with the campaign and what are our next steps and what we're doing right now. Until today, we have administered in the county more than 29,000 vaccine doses. Those include vaccinating all the hospital employees that ask for the vaccination, and right now our local hospitals are engaged in offering the second dose of vaccine to their employees, and also we started vaccinating the rest of the healthcare providers workforce here in Clark County. As you may know, the vaccine is being distributed in phases. We right now are still engaged in the first tier of offering vaccine to healthcare providers. As you heard from the state and the governor this week, the state of Nevada modified its vaccination playbook, and now it will be look at two different priority lanes, one based on age and the other based on occupation or essential workforce groups. So right now, the health district is offering vaccines at our main site at the Carter Boulevard and also at Western High School. Also, our partners, such as the University, UNLV, Roseman University, and Toro University, and collaborating with us in this vaccination campaign. And they are also offering this vaccine at different days during the week. Also, this week, the county will open the Cashman Center as our first mega site for the vaccination campaign. And the details of that will be shared later on. I also want to say that starting tomorrow, we will be offering vaccine to seniors 70 years old and over. And also we'll start offering a vaccine to the frontline community essential workers, and that, according to the state playbook, is the first block coming after public safety, which is already included into the target for this phase of the campaign. So in that frontline community support, there are different groups that I will mention some of them. For example, education, which is pretty much our Clark County School District employees, and also employees from other health systems here in the county. Also, the Nevada System of Higher Education, which is the colleges and universities included there. and also included there are continuity of governance, which is city and county government employees and staff, as well as transportation, and also mortuary services. And then there is another group which is more widely defined, which is called community support frontline staff, and that's a relatively large group, and we will publish the definition of that group so everybody can see that properly. We want to emphasize that now that we are expanding our offer of vaccine to the community, we need to be aware that that this offering is contingent to the availability of vaccines that we receive from the federal government through the state. Our capacity is starting next week will be to be able to vaccinate between 40 to 45,000 people a week, and our ability to reach that number weekly, of course, is depending on the number of vaccines that we receive every week. And this is something that we are, of course, working with the state and the federal authorities in order to make sure that we receive those vaccines. So what I mean by this is that we will need a lot of support from our community in terms of understanding that not everybody can be vaccinated at once, because our capacity doesn't allow to reach all our residents at once. And the vaccine will be available to all our residents as we move forward on this campaign. I will stop here and I will introduce uh, our chairman, Mr. Scott Black, and then our Commissioner Kirkpatrick to follow up on this.
Thank you, Dr. Ligon. I first just want to say how much I appreciate the dedicated effort from you and your team at the Health District. I've spoken to Ms. Rupiper on a number of occasions, and even though the Health District is working in concert with the state in terms of allocation, in terms of building and customizing the plan that works best for Southern Nevada, it's critically important that we create a branch out approach to all the community partners you mentioned. In INCHI, UNLV, CSN, we have lots of partners that we need to lean on to make this campaign successful. So I just want to say thank you to you and your team and your leadership. Definitely Commissioner Kirkpatrick, for her and her team for the leadership to just, she's the one on the front line keeping she's the glue that keeping this organization together in terms of this effort from beginning till now with the pandemic. So I just want to say thank you. And, from a North Las Vegas perspective, we're here to help and be a partner as well as everyone else in the community. So thank you.
Thank you.
Thank you, Dr. Ligon. And really, for the press, there's a couple of things that you can do to help us help the community. It's super important that folks remember that this is being done very methodical, and we have to roll this out much like we did with testing so that we can work through the bugs. And but we have a great model, and we will be rolling out this vaccine. So first and foremost, we ask for your patience, because it does take patience to get through this. And remember that you already have the tools at home today, which is hand washing, social distancing, that you can do to help us until we can get to you vaccinated. But we are, we have two tracks that we have to do. One, most importantly, is we have to take care of our seniors, because we know our senior population, 60 to 80, is the highest capacity in the hospitals. So it's very important we have that track. At the same time, we also need to preserve our workforce. Remember, we're over 1 year into this. For many of us, we started back in January of last year having these discussions. So if the press, understand that we just need a little bit of patience. There are several different groups that we have to get to. We are asking employers to start asking your employees how many are even anticipating getting it, because as Dr. Lagon pointed out, that does help us kind of plan a little bit better with our projections. Joanne is only as good with the numbers as she knows what's coming. And she has to try and balance the vaccines today that we're getting versus the highest need out there. So Dr. Lagon, really the health district has done yeoman's work on this. And I think most of us thought we would be done around summertime. However, I feel like this is the last hurdle, and the county and Chief Steinbach is amazing with his team. I feel like we're in a good spot, and the press can just help us navigate over the next couple of weeks, and we can get through these groups, that we will have a well-oiled machine for you, and we will be able to move these vaccines through our community. So thanks for having us on here.
Thank you. Chief?
Just here to support you today, Dr. Lagan, and answer any questions that may arise that run down on the operations side or with emergency management. So thank you, sir.
Thank you. Okay, Joanne is our chief administrative nurse and is leading our vaccination campaign operations. So Joanne, please.
Well, hello, good afternoon, everyone, and very happy to be here and share our information about our vaccination campaign. And I do want to say I really appreciate the county and the Chief Steinbeck and his crew for assisting us in getting this vaccine out as quickly as possible. The county and all the municipalities, City of Henderson, North Las Vegas, and Las Vegas, Mesquite, and Boulder City have all been really helpful in customizing our plan for their communities. So we're really happy to have them on board, and they're getting us some resources that we can get vaccine out even quicker. And we're looking at doubling our capacity in the next week or two, and also trying to serve the needs of those over 70 years of age, which we're really relieved that we can have that ability to do so.
Okay, thank you, Joanne. Corey.
Okay, let's open it up now for questions. So if you are joining us by your computer, use the raise hand feature, which is on the bottom of your participants list. Our first question today comes in the chat box from Dana Gentry. Are there any vaccination sites outdoors, or are you planning to have any outdoors?
Do you want me to take that?
A question for Chief Steinbach, or right, Chief Steinbach, as far as logistics?
Many of us can answer that. I'll go ahead and let Joanne answer, and then I'll add on to that.
Sure. I mean, right now we have big enough venues indoors to do vaccine, which is preferable. This vaccine has to be kept cold, and so if we're outdoors, that can be very inconsistent. So we would rather do it indoors. If there is such a time that we would have to move outdoors, we would certainly do that. But really giving a vaccine or a medical procedure out in the elements is not the best practice.
All right. I just want to say that there are additional vaccines coming into the campaign that will be submitted to the FDA for emergency use authorization. It's one of them, like the one from Johnson & Johnson, probably might be the one that could be used on that kind of scenario, but still we have to wait for those vaccines to be authorized by FDA. Thank you.
And then I'll just answer to Dana that we've looked at outdoor facilities. They are there as options as capacity and grows. They are options, but still within the restrictions that Joanne had spoke of. But I just wanted to convey that there's many outdoor locations and facilities that are being considered as options.
Next question today is from Michael Scott Davidson.
Hi there, everybody. Michael from the Review Journal. Thank you for taking the time to do this press conference today. I had a question about the workforce to actually get vaccines into arms. If we're planning on doing 40,000 to 45,000 per day, who will actually be the people that are, administering the shots? What kind of training will they have? And how will we pay them? And approximately how many will we need to administer that many per day? So just to recap on that, how many people will it take to administer 40 to 45,000 shots? Where are they coming from? What is their training, and what will we pay them? Or how will we pay them?
Joanne?
Yeah, sure. So typically nurses are usually our frontline staff that we use for vaccine. We have been doing vaccine here at the Health District for many years, and we've had an outreach team that has trained enough so that we can train others. So we have a train the trainer model. So we are getting vaccinators from the universities, the nursing schools, medical schools, and training their professors to train and also monitor those vaccinators. EMTs and paramedics are now able to be vaccinators. So we have been doing a train the trainer model with all of the municipalities so that they can get enough vaccinators up and running. So that's how we've been doing it. And it takes a lot of people to do these clinics. And we are getting another partner, Clark County School District nurses, and they had been working with us in testing. So that's where we're going to draw from, getting 40,000 to 45,000 in a week. And we can certainly do it. I'm totally convinced that we can do this safely and effectively for our population.
Go back to our chat box for the next question from Michelle Price. She asks, can we repeat the numbers, please? 29,000 doses administered thus far. And do we know which frontline essential workers will be up first starting tomorrow, along with those 75 and older?
Okay, Joanne, you.
Yeah, okay. So 29,000 is what is been recorded. And we expect twice that amount next week, in the next week and a half, I would say. And keep in mind, we've been doing frontline workers since December 14th, when the hospital started their workers. And that filtered down to, they're in their second dose right now. And then we're moving down the line with nursing homes and with those residents. So we've been vaccinating not even a month yet. And we really had to wait till those folks got their vaccine first. And now we're moving into our tiers. We have partners working with our, when I'm looking at public safety and security on the new plan, that group is moving along really well. And but we're still working on that big medical group. There's about 50,000 people in there. So once we get it offered to everyone, then we move into the next group, that frontline community to support. At the same time, will we be also offering vaccine to those 70 and older, and that we will do concurrently in a parallel fashion. And we just started doing that today. Or I'm sorry, we're starting tomorrow and then through the next week. As we increase our capacity, there will be more opportunities for that group to get vaccine.
Our next question comes from Mary Hines.
Hi. So our seniors are looking for actionable information, and they're hearing that they can get vaccinated tomorrow. So how can they do that? How do they go about it?
Well, they can access our website for appointments, and keep in mind, appointments are limited at this point. However, we are getting more appointments available as we get these clinics up and running. Some of the municipalities have some capability as well. And that's why we have the county working with us to be able to get messages out to those over 70, and working with communities that they live in, and also working with the cities and those senior centers and hospitals that may have access to that population.
Right. And also, I want to add that pharmacies, Smith and Walgreens, they will start offering vaccine January 20, according to information we received from the state. And the details on how that's going to be will be posted and shared once it is received from the state and those companies. But the seniors will receive the vaccine from us and also from those pharmacies as well.
So Mary, this is Marilyn. I'm concerned. I want to make sure that your story specifically says, please don't come to the health district. Please don't come to UMC. If you do not have an appointment, please wait because we will not be ready for you. So it's important that they know that it is 78 and older are the limited appointments that the health district has today, that they will be starting tomorrow. So as we ramp up and as we get through the community, we have many different avenues to get through them. We believe within the next 2 weeks, the allocation to the pharmacies will be done. We are working with the state to ensure that we'll know exactly where they're at. But all of this is super important that everybody realize the importance of having an appointment. Because once you open that file, you have to give the vaccines because we do not want to waste any. So it's important that people know if you take the time to make an appointment, please show up because we're relying on you to be there. And if we don't, there's a reason why we're limiting them, because we know how many clients that we got to see in that time frame to make sure that we do not waste any vaccines. And we are super proud that out of 29,000 that have been administered, less than 10 have had some type of flaw. So that's we're taking great care with it. So if you could please ensure that our residents know that it is slow and methodical, and we will turn up the machine real soon and we'll get them lots of information. But this week, I need them to please try to get your appointments and know that more information will be coming. This is a very fluid situation, and it'll take us a week or so to be able to ramp it up, much like our testing, and then everybody can come.
And a quick follow-up, when do we expect a mass vaccination clinic?
Well, we've already started some mass vaccination clinics. They're closed pods, so they're kind of by invitation only. So we'll probably be using that model for quite some time. And so certain groups will be asked to make appointments, and then we check when they come in whether they really belong to that group or not. Does that answer your question okay?
I'm just wondering when it does. I guess a follow-up would be, how are you verifying their identities?
Well, either ID or some type of, if their employer badge or some type of identification like that. Age is easy.
Thank you.
Can I ask, were you asking when we would have sites open that would have increased volume? Is that the question?
It was. Yeah.
Oh, okay.
I'm wondering if there's one of those really large sites,
Yes.
And when we might see that.
Yeah, absolutely. So Cashman Field is our first of what we call the megapod. And so that has a soft opening of tomorrow, which is to work out some of the logistical issues that might be there. Again, that is with those frontline medical providers that will still be pushing people over there to tomorrow for that to occur. Starting on Friday, it will be opened up with increased volume, hoping to be able to do 2,000 a day. Our hope is that that site in the coming weeks will be able to do 4,000 a day. And then we plan on replicating that as necessary through the valley, as long as supply and the human resources to push it out match it, which I believe we will have the human resources side of it. The supply side, I would have to leave to Dr. Legan or Joanne.
Right. Right. Thank you, Chief. And also, we want to add that we will open a second mega vaccination site at Las Vegas Convention Center, and that probably will be within the next 2 weeks.
Our next question today comes from Astrid Mendez.
Hello, everyone. I wanted to know, you've been mentioning about the mega pots and basically how is it going to be for seniors, but we have to remember that there are some seniors that are not in a senior center and they do have mobility issues. So what is the plan to actually get a hold of them? Not everybody will have a ride, not everyone will be able to go to this mega pot places, and still they will still need the vaccine. So what is it being done on that part? And my second question, since we have a lot of people here in Nevada that have not been able to register as citizens or residents here because of everything that's going on with the DMV, what I'm trying to ask with this is, will out-of-state residents will be able to also be part of this vaccination plan, even if they don't have an ID to show that they live here, or or any other form of identification, but as long as they're part of the 75 group, will they be allowed to get their vaccine?
Okay, I will start by the last question and move forward. I think that that last question is a very tricky one, and I will add to that also. We know that there is a relatively large undocumented population here in Clark County. What I will say, and the Commissioner Kirkpatrick and Councilman Black can help me with this later, is that if the person doesn't have a driver license of Nevada, because you mentioned they are struggling getting through MTV and those kind of things, still they have to show proof of residence here, because otherwise what might happen is you will have people who come here during the weekend for entertainment, now getting the opportunity to also get the vaccine in Las Vegas. So that's a very fine line that we have to walk. I don't know, Commissioner, if you want to add something.
Sure. And Adrian, to your point, you had a lot of questions within a question. And I think that, right, as we work through all of this, we've had those discussions. There are, so one of the things, that's why there's a lot of folks in our valley between 70 and 103, that's a pretty wide range. That's why we're starting with 78 and above, because that's one group that we can get. And then as we go through them, we're going to get to the next group. But look, we have worked super hard, worked with the state, equality across the board. That is why we're running different tracks. That is why we have a Hispanic outreach group that is working through those conversations that the health district sits on, and many of our local Latino groups. We have had several calls, Dr. Legan and myself, with the faith-based leaders, because we are going to have all of those people are going to help us. And then we are also working, don't forget, with the Department of Aging and with our seniors and home health care workers. So we are fortunate that we are a small community in the grand scheme of things, and that we can collaborate. So there are over 80 of us that are on a minimum of 5 calls a week where we collaborate with other partners. So our goal is to be able to not miss anybody who wants the vaccine as we roll through this. But it's going to take time, you know, and so we've done a fairly great job so far with the limited resources. And imagine, you know, we don't know what we're going to get for the vaccine the following week. So it's really hard to plan with something that you're not aware of. We're hoping that that changes. We've been working with Health and Human Services, so we will continue to move through. As we get through those 78 and older, then we'll reach down to, you know, I don't know what the number is. Maybe it's 74 to 78, depending what that demographic looks like. And we'll continue to move forward as we also ensure that our workforce is safe. So you can be rest assured we're working with 144 different languages within our community, and that we have many different subgroups, faith-based leaders, that we're all working together and talking to ensure that nobody gets left behind if they want the vaccine. Did that help, Dr. Legon? Sorry, long answer.
Yes, so.
Could I add a couple things with that? They were talking about the difficulties with people getting to these megapods, and we have been talking about that, and so that's why we're going to reserve appointments for those who have mobility problems to, for example, at the health district here where the distance isn't so much, or other more easily accessible. And then I also, we are still working on getting a clinic for those with disabilities or with cognitive issues where you would not want someone in a noisy big pod. So those are some things we are considering. And as far as an ID or whatever they would need for vaccination, keep in mind if they live here, they can get a vaccine here, okay? So we just ask for ID because it's a medical procedure. We have to know that, yeah, that's you, that's your birth date. But beyond that, we don't really collect any other information except general demographics. So just to keep that in mind, that we're not asking for birth certificates. We're not asking for that type of ID. If you don't have a Nevada ID and you live here and you have something else that can identify you, that works just fine.
Right. I just want to emphasize that we don't look for immigration data, so we don't ask for that kind of status from anyone. That's not a requirement for a person to get the vaccine here. The only requirement is that they are Nevada residents, and that's what we try to figure out. I just wanted to say regarding the seniors also that, as I mentioned before, the pharmacies will be also offering vaccine to the seniors, so they will have that possibility in the neighborhood based on the agreement between the state and some of those pharmacies.
Before we move on, I've got two things to note. If you are hoping to do an interview with Dr. Legan in Spanish, we will save that for the end of the interview today. So at this time, please lower your hand and we will return to you. And if anyone has any follow-up questions to questions they've already asked, please send those to the Office of Communication. We do have a lot of brand new people that we want to get through right now. So our next question, we're going to take from Joe Moeller. Wait, hold on. Where'd you go? Okay, there you go.
I'm here. Yeah, this is Joe Moeller from Channel 8 here in Las Vegas. I am wondering the number of locations that the vaccine will be administered. Do you have a number of locations that is? And I heard you just mention pharmacies. What sort of information should people know about what particular pharmacies will be able to give this out? And if you could also clarify, someone had asked a question about 40 to 45,000 vaccines a day. I just want to clarify that is the goal for a week.
Okay. Information about pharmacies, the only information I can share with you today is that as today, the state is working this agreement with Walgreens and Smith pharmacies. Now, the location of the pharmacy, that's something that will be disclosed by the state once they are ready to do that. The plan is to start that program January 20. but that information will come from the state, and we will share with you. The second question was?
Oh, sorry, I unmuted him. Let me find him again.
Okay, sir.
Joe, can you raise your hand again? Oh, wait, I just found you.
All right, there we go. I figured it out. Yeah, someone had asked a question earlier about the goal a day, and I think is it 40 to 45,000 a week, right?
It's a week, right? It's a week, and there are multiple sites. I can tell you, we have the site here at the campus for the health district. Also, we have the Western Heights School, also UNLV, Roseman University, Toro University, Cashman that will start on certain Friday. Also, City of North Las Vegas. We have also UNC. We have the City of Henderson. We have also in the near future Mesquite and Boulder City add to that equation, and that's pretty much what we have right now. Joanne, I think that's from our table. I don't think I'm missing any right now.
Yeah, I think that would cover it, and we may find other partners in the future, but those are the main ones right now.
Yeah.
Next up is Jacqueline Schultz from Fox 5.
Hi, everyone. Looking for some clarification on the 78 and up. Is that only for the Southern Nevada Health District site, not for the pharmacies or the Cashman Center? And then a big question I have is, practically, what do you need to know and prepare for when you go to an appointment? How much time? Definitely your ID, proof of residence, any other medical documents if you have allergies or whatnot. And then where does your personal information go? A lot of people have questions about privacy.
Joanne?
Yeah, sure. So when they come to any of the mass vaccination clinics, an ID, if they're in a group, some type of proof of that they're in this group, like a pay stub or something like that. And possibly some insurance information. We're not collecting that now, but we may be in the future. And they should know about their medical history as far as anaphylaxis, if they've ever had a reaction to a medication or food that would cause them to use an EpiPen. And those with conditions that may suppress the immune system. And so if they have that type of condition, or they're pregnant or breastfeeding, they should really discuss with their doctor first and determine whether they should get the vaccine or not. Those are the main questions. Also, if they've had a vaccine in the 14 days before the date of their COVID vaccine, we cannot vaccinate those individuals. So we screen for those right away when they come in, and then they, get the vaccine from the provider, and then we have them stay for about 15 minutes to monitor to make sure that they're okay and that there is no reaction. And then we have a medical support if that does occur. I would say it's really hard to say how long it would take. I mean, it could take anywhere, maybe 10 minutes, maybe 20. I mean, or if you have to wait in line, if people really adhere to the appointment system, it goes a lot quicker. So did that answer all your questions?
Joanne, I think she's asking, and I've been accused of misquoting and everything, so it is 70 and above. That
70, yes.
Within this, but I thought that I heard Dr. Lagon say that we were going to try and manage our seniors so that we didn't have a free-for-all. So we were trying to limit groups, but it is 70 and above. So please do not misquote to seniors, because they're already calling because they all want to know. But we have to figure out how to manage the seniors so that we don't have thousands of seniors showing up at the same time and sitting outside and waiting for hours. And that's really
Correct.
what we're trying to avoid. So it is 70 and above.
Yes. Yeah.
But we're trying to manage groups so that we ensure that we protect our seniors while they're waiting to get protected.
Right. Yes, it's 70 and above. And I think you were asking about pharmacy access too. How will that go? And that is yet to be determined. I would guess that though that access will be done through the pharmacies. They're pretty good at getting their information out there. Our website will continue to compile information on clinics and access on our website as we find out that information.
Joanne, I think Jacqueline also asked about the privacy of the information that they supply when they make an appointment.
Correct. So it is a medical record. So we have security in place so that people do not have access to that record, except for those who really need to have it. Okay. So our documentation system is secure, and as well as, like, for example, like the hospitals and UNLV are using a system, electronic system, that is what everyone else uses in their medical offices and in their hospital. So it's the same type of system. Our vaccine information is required by state law to be reported to the state immunization. Nevada WebIZ is the immunization information system. And so that people can look and they can find their own record through a patient portal, and they can get their record through that. So that's exactly where the data resides. It resides in any medical office like our system, or if it's UNLV, it's their EPIC system, and same thing with UMC and all the hospitals. What we are doing at the for Cashman will be residing in our data. So it is handled the same as if you would come to our office and get any other procedure.
We're going to take one more voice question today and 2 questions from the chat box. So our next voice question comes from Frank. If we can get him unmuted. There you go.
Hi, it's Frank Nemec, Board of Health for the Southern Nevada Health District. My question is, does the health district plan on continuing to hold back half the doses in preparation for a subsequent boost in 3 to 4 weeks, or will the vaccines be administered as they arrive?
So the vaccine is not held. The second dose is not held here at the health district. It's held at the federal level. So the federal government reserves that second dose, and when it's needed, it gets shipped to us. So we don't have it on hand. However, it is our understanding through communication with CDC and the state is that when we are ready when that is due, then that vaccine will be shipped to us, and then we give that concurrently with all the other first doses. Does that make it clear?
Well, I just want to add that according to news coming from regarding the next administration, actually there will not be any more holding of the second dose, and that probably will happen after the change of administration.
Next question from the chat box comes from Damon Smith, asking, how will vaccinations be tracked once hospitality employees are included, and will employers have access in order to track completion at our properties?
Well, typically employers it is a medical record. And so typically employers do not have access. However, we all know that many medical facilities, do keep track of vaccinations of their employees. So typically what employers would do is ask for that documentation that they have received the vaccine, for a particular reason. So at this point, it's accessible to the individual only and their healthcare providers.
Okay, let me clarify here because just to make sure everybody understand. Okay, the question was, I believe, hospitality people, which is different from the hospital people. The hospital, they have the dual function of being employers and also they're administering the vaccine. So just because of that particular situation, they have a pretty good idea of how many employees are being vaccinated. That doesn't happen to the rest of the community because the information from the people who receive the vaccine is actually protected by HIPAA, is confidential information, and the health district cannot release that information to the employer. So it is actually a function between the employer and the employee on how they want to communicate that kind of information among themselves, but the health district cannot assist any employer with that kind of information.
Another question from the chat box. Gerard Ramalho from Channel 3 is asking, will all vaccines require appointment through the health district, even if they're at a pharmacy?
No, no, it doesn't. The health district, what it's doing is just facilitating the information to the community. So we are trying to post in our website as much information as possible to help our community identify a vaccination site where they can go and get the shots. It's not a requirement that each pharmacy place the registration site in our website. We are just providing a service to the community. So the answer to that question is no.
Okay, well, I'm sorry, Marilyn, go ahead. Commissioner Kirkpatrick, you are muted at this time. Please unmute yourself.
Sorry, sometimes it's good if I mute myself. So what I just want to press upon to the press is, this is no different than how we do the flu shots. We have several pharmacy partners where you can go to your local pharmacy, you can make the appointment with them to get their flu shot, or you can choose to come to the health district. This is just a bigger scale of doing it. So it's not new, except it's much bigger. This is what the health district does do. This is how we work with our community partners across the valley. Even when it comes to employers may ask to make sure that you got your TB shot, right? Or to make sure that you got your healthcare shot. So the employers, that's entirely up to them. But for us as the health district, this really is just on a bigger scale. It's a little bit harder to navigate, much because of the sensitivity of the vaccine. So we have to be mindful of that. But that is one of the reasons why we've brought in so many partners in, because people are used to and comfortable going to the Walgreens or to the Smiths to get their flu shot. And we want them to have that same option, or they can have one of the other sites. So it's important that we not scare people from getting the vaccine, although it's a little bit rough in the beginning, as it is any other normal flu season. We're trying to get as many of them out. So I just want to make sure that people understand that this is what we normally do every year pre-flu season. And this is just another vaccine within our wheelhouse that we have to move forward with. And we want people to realize that we have a lot of folks that get the flu shot, and it should be, we're working very hard to mirror that operation so that they have options that they're comfortable with.
At this time, we will be wrapping up the English portion of this interview. If you are from the media and you have a follow-up question or a new question, please feel free to reach out to the Office of Communications. If you're a member of the public, feel free to send an email to snhdpublicinformation@snhd.org, and we'll be happy to get back to you as soon as we can. And if you are looking for all of our COVID information, including how to make an appointment, our direct COVID website link is www.snhd.info/COVID. But please be patient because we are experiencing high volumes of traffic on the site today, so it may be slow at times. So once again, reach out with your questions, visit us online, and thank you all for joining us. And at this time, we will be moving on to the Spanish portion with Dr. Leguen. Okay, I've got a couple of questions for you, Dr. Leguen. Do you want to do any kind of introduction or jump right into them?
Okay. Okay, let's try to make a brief introduction.
Sorry to put you on the spot.
Buenas tardes. Hoy el Distrito de Salud va a informarle al público acerca de cómo se está desarrollando la campaña de vacunación en nuestra comunidad y cuáles son los siguientes pasos que vamos a tomar. Primero quisiera informarles que hasta el momento hemos vacunado más de 29,000 personas aquí en el condado, tanto con la vacuna de Pfizer como la vacuna de Moderna. Estas primeras dosis han sido administradas a trabajadores de la salud, ya sea en los hospitales de aquí del condado, como trabajadores de la salud que funcionan en el sistema ambulatorio, sea oficinas médicas o áreas de terapia y otros centros de salud. Nosotros en este momento lo que estamos es planeando comenzar a partir de mañana a ofrecer la vacuna a otros grupos. En este caso vamos a comenzar a ofrecer la vacuna a los residentes del condado que son mayores de 70 años de edad y también a lo que se le llama en el plan del Estado los trabajadores esenciales. Dentro de ese grupo de trabajadores esenciales vamos a ofrecerle la vacuna al primer bloque que aparece en la línea de prioridad del plan del Estado. Ese primer bloque incluye los trabajadores de la educación, tanto del sistema del condado, de las escuelas públicas como escuelas privadas y otros sistemas que existen aquí en la educación. También le vamos a estar ofreciendo la vacuna a los trabajadores del sistema de educación superior, o sea, lo que se llama los colleges y las universidades. Igualmente, se le va a estar ofreciendo la vacuna a los empleados que trabajan para la ciudad y el condado, así como también a los que trabajan en transporte público y a los que trabajan en los servicios mortuarios, y también a un grupo que es un grupo un poco más diverso, que es el grupo que se llama trabajadores de la comunidad de socorro, de apoyo, que es un grupo bien diverso que que incluye, entre otros grupos, por ejemplo, personas que hacen trabajo, servicios sociales, que trabajan en las cortes, en el sistema legal, shelters, y otros grupos. Eso va a estar más definido en el website porque es un grupo bien difuso, ese que acabo de mencionar. Pero bueno, estos van a ser los grupos que vamos a comenzar a partir de mañana. También que queremos señalar que en estos momentos el Distrito de Salud está trabajando en esta campaña con varios colaboradores, como son el condado, las universidades como es la UNLV, la Universidad de Las Vegas, también Roseman University, Toro University. Igualmente estamos trabajando con el Hospital Universitario UMC y con las ciudades de North Las Vegas, y Henderson, que ya están en estos momentos ofreciendo vacunas a su población. Y en el futuro cercano, igual las ciudades de Mesquite y Boulder City también van a comenzar a ofrecer vacunas a sus residentes. La otra cosa que quería decirles es que esta semana, a partir de mañana jueves, el condado va a abrir el centro de Cashman. Mañana va a ser un día como de prueba de este centro y ya el viernes va a estar ya a funcionar a plena capacidad. Este centro de Cashman va a ser un mega center para la vacunación. Se van a ofrecer diariamente entre 3,000 y 4,000 citas para recibir la vacuna en este centro. Además de eso, dentro de las próximas 2 semanas, el Distrito de Salud va a abrir otro megacentro en el Centro de Convenciones de Las Vegas. Este megacentro que se va a abrir por el distrito también va a ofrecer entre 3,000 y 4,000 dosis de vacunas diarias. O sea que vamos a tener dentro de 2 semanas dos grandes centros de vacuna que van a estar abiertos a la comunidad, además de centros que como les mencioné anteriormente, en las distintas ciudades y también por la Universidad de Las Vegas, UNLV, Toro, Roseman, que van a ofrecer también la vacuna. Algo también importante es que nosotros calculamos que nuestra capacidad semanal va a ser de alrededor de 40 a 45,000 vacunas que vamos a poder ofrecer a nuestra población. Pero hay que tener en cuenta que esa capacidad pudiera estar disminuida si no recibimos la cantidad suficiente de vacunas del Estado y el gobierno federal para esa semana. Pero nuestra capacidad va a estar hasta 40, 45,000 semanales, y si las vacunas se reciben, pues todas serán ofrecidas a la población. También que es importante que las personas sepan que para recibir esta vacuna van a tener que anotarse, o sea, registrarse a los distintos sitios para tener su cita. Porque lo que no queremos que suceda es que las personas estén pasando largas horas de espera a centros de vacunación para que al final estén frustradas y no reciban la vacuna porque no estaban anotados para ese día y no había vacunas extras para las personas con las que no se contaba ofrecer el servicio ese día. O sea que es importante que sepan eso, y también que desgraciadamente todos no vamos a poder ser vacunados el mismo día ni la misma semana, y necesitamos el apoyo de ustedes en cuanto a que tengan paciencia con nosotros y vayan esperando según le llega la oportunidad de vacunarse, pero importante que se anoten y para que tengan la cita. Y voy a parar aquí y para algunas preguntas que puedan tener ustedes.
All right, so our first question comes from Fernando.
Hola Fermín, ¿me puedes oír?
Sí, hola, hola, sí, te escucho, sí, Fernando.
Hola Fermín, nada, gusto en saludarte. Gracias por permitirnos recibir preguntas. Lo más importante, ¿no? ¿Habrá por fin personas que no son sanitarios ni personas que trabajan en residencias o residentes en residencias de ancianos que van a empezar a recibirlo? Las personas de mayores de 70 años, ¿cierto?
Sí,
¿Cuándo va a ser? ¿Qué tienen que hacer si las familias que nos puedan escuchar, que tengan un familiar o probablemente una abuela, un abuelo, qué es lo que tienen que hacer para ello? ¿Y cuándo estiman aproximadamente ustedes que se va a pasar a la siguiente fase de las personas de 65 a 69?
Ok, bueno, Fernando, gracias por la pregunta. Nosotros, como dije anteriormente, vamos a ofrecer la vacuna a las personas de 70 años y más en nuestros centros de vacunación que van a estar extendidos en múltiples sitios de condado. Ahora, junto con estos sitios de vacunación que nosotros mencionamos anteriormente, existe otro recurso para nuestros ancianos y es el recurso a través de farmacias locales, en este caso las farmacias de Walgreens y Smith, que tienen un convenio con el estado de Nevada y de acuerdo con la última información que nosotros recibimos del estado, estas farmacias comenzarán a ofrecer esos servicios a partir del día 20 de enero. Los detalles de cómo el servicio va a ser ofrecido, nosotros no lo tenemos en estos momentos. Eso es algo que el Estado lo va a comunicar en cuanto ellos tengan todos los detalles ya de cómo va a ser esa operación, igual que estas dos farmacias que mencioné, van a acercarse al público a informarles cómo va a ser y lo más posible es que ellos le envíen comunicación directa a las familias en su vecindario de que el servicio está accesible en su farmacia local y ellos puedan tramitar el servicio para sus ancianos allí. Ese es un recurso importante en combinación con el otro de asistir a los centros de vacunación. Aparte de eso, van a haber, ¿cómo se le llama? Strike teams o equipos que van a estar compuestos por el número pequeño de personal sanitario que van a ofrecer la vacuna a determinados sitios específicos. Pero ese tipo de intervención es más relacionada con organizaciones, en este caso, que trabajan con ancianos en determinadas comunidades y tienen un número de ancianos que forman parte de esa organización, de esos grupos, y entonces ellos van a coordinar con el Departamento Distrito de Salud o a través de nuestros colaboradores para poder traer esa intervención a sitios que ellos tengan ya predestinados. O sea, el acceso de la vacuna para las personas de 70 años y más va a ser diverso. No va a ser solamente en los sitios estos grandes de vacunación, también va a ser en las farmacias locales y también van a haber oportunidades con pequeños equipos que van a trabajar con ciertos grupos comunitarios que van a ofrecer ese servicio a los ancianos. Y eso se va a ir conociendo según nos movemos en esta campaña. No sé si contesté tus preguntas. Okay, Corey.
Okay, Telemundo had a couple of questions in the chat box. I'm going to read these the best that I can, so please bear with me. North Las Vegas ya empezará a tomar registraciones para los adultos mayores de 70. ¿Cuándo sería para el resto del condado?
Ok. O sea, la pregunta de Telemundo parece ser que es relacionado con la ciudad de North Las Vegas que está tomando citas para vacunar ancianos y cuándo sería eso para el resto del condado. Bueno, yo creo que esa pregunta ya la respondí con mi comentario anterior. A partir de mañana nosotros vamos a abrir las citas para los ancianos y el grupo de trabajadores esenciales que mencioné anteriormente. O sea que los ancianos van a poder recibir vacunas en los sitios de masivos de vacunación, ya sea en nuestra oficina aquí en el Decatur, como en el Western High School o también a través de la ciudad de Las Vegas o en la ciudad de Henderson, que también están ofreciendo vacunas. Y también en el centro Cashman, que va a comenzar a operar el jueves, mañana jueves, ¿no? So, a partir de mañana. O sea, son los sitios que en estos momentos van a estar disponibles y a partir del día 20 de enero, las farmacias de Walgreens y Smith van a empezar a ofrecer ese servicio también. Como dije anteriormente, los detalles de cómo va a ser el servicio de las farmacias, nosotros no los tenemos en estos momentos. El Estado los va a comunicar en cuanto ellos estén listos para hacer esa noticia. Eso es lo que tenemos hasta ahora. Okay, Corey.
And the final question for today is, ¿qué tipo de info se necesitará para cuando la gente se registren?
Ok, parece que la pregunta es qué documentación necesitan las personas para las citas. Bueno, lo que se pide es que la persona tenga un documento de identificación, o sea, algo que nos demuestre que esta persona es quien la persona dice que es. Eso no tiene que ser la licencia de conducción, porque sabemos que existe un número relativamente largo de personas en esta comunidad que están indocumentadas y no tienen acceso a una licencia de conducción. Pero cualquier documento que la persona presente que demuestre que la persona vive aquí en Nevada, es suficiente para eso. O sea, no tiene que ser pasaporte, ni tiene que ser la licencia de conducción, cualquier documento que la persona muestre con su nombre. Y ya eso es suficiente para nosotros. Okay, Cody, asking if that's what he was asking. I guess it was, but.
Hope so. Okay, that's all for today. No more questions. Thank you all for joining us today. Thank you, Dr. Ligon, for being awesome. And we will see you guys next time. Have a great rest of the week. Thank you.
Thank you.